topic. I'm going to talk about something that I know is going to be mischaracterized, and people are going to misquote me. And yeah, I've got my watch started to see how long it takes for someone to mischaracterize what we're talking about today. This is going to be one of my most misunderstood videos. I've done over 600 videos on all things Social Security, helping people throughout the country make sure they're getting their retirement benefits, survivor benefits, spouse benefits, Medicare, Medicaid. That's my new mission in my semi-retirement. After I stopped working for Social Security Administration, I ran the third busiest Social Security office in the country. And my new kind of mission in semi-retirement is to make sure y'all are getting everything you're entitled to, you, your family, and friends, but also make sure it's around for the long term. I want Social Security and Medicare to be here better for my children and their children and everybody in the future. So I do these kind of solvency trust type of issues as well, not only helping you get your benefits. So this is only going to take about 10 minutes, not very long. I'm not going to spend a lot of time on it. And then I'm going to open it up as I usually do. This is a live Q&A after. And so make sure you type your questions in chat on all things Social Security, Medicare, retirement, disability, and all that kind of good stuff. And I will answer as many questions I can in about an hour. All right. So what are we talking about here? This is a long-term strategy. If you've watched my channel before, you know that there's an attempt to privatize Social Security and Medicare. Medicare is they're privatizing Medicare fairly well through the Medicare Advantage plans. Over 51% of Americans join those Medicare Advantage, which is a kind of a privatization of Medicare. And they're also doing the same with Social Security. They've been trying to privatize Social Security since it was started. The year after it started, 1935, they immediately started going after Social Security. It's a long-term strategy. People say, okay, Ed, you keep saying that, but is there, do you have kind of proof? Well, there's kind of, all you have to do is, the health insurance companies of Wall Street and the politicians and the people that want that right now, it's what, at $2.7 trillion of the trust fund. They want that money. It's interesting. The business owners and, the people on Wall Street say it's all fake money. It's all fake money. But we really want it. It's like, okay, if it's all IOUs and fake money, it doesn't exist, then why are you going after it? So anyway, it's ironical, as Winston Churchill used to say. All right, so here is an article I found from 1983. So achieving a Leninist strategy. And it's a very interesting choice of words because Lenin, left, communist, socialist, and the right, conservative, are completely polar opposites. But but they use that term. And why did they use that term? Is because you can read the article. It's in the Cato Journal. And the Cato Journal was actually started by the Koch brothers, particularly Charles Koch. And, they want pure capitalism, essentially, no welfare, no social safety net or anything like that. So they've had it out for Social Security for a long time. They want it completely privatized and given over to their Wall Street buddies. So you got a couple of people here, the authors that wrote this, Achieving Leninist Strategy in order to privatize Social Security, and their strategy and how to privatize it over the long term, because outright attempts have failed. Where Congress meets and they say, hey, let's just go ahead and get completely rid of it and privatize it. And they've tried that several times and it's failed. So this is a long-term strategy to do that. And both of these authors worked for the Cato Journal, the Cato Institute, wrote in the Cato Journal, 1983. And again, Koch brothers. And they went on, both of these guys went on also to work for the Heritage Foundation, Project 2025. And a lot of the arguments in that are also in the Republican Study Committee about, raising the retirement age to 69 or 70, cutting a lot of benefits from people. So their argument, why they use the Leninist strategy, gets kind of into a little bit of the weeds on Marxism. Karl Marx said, capitalism is doomed by its inherent contradictions. So Karl Marx says all you have to do is sit back and twiddle your thumbs and one day capitalism will die because it's just a terrible system and it will die of its own natural death. And Vladimir Lenin said, not so fast. We need to give it a little nudge. We need to help it along a little bit, poke it, twist it, whatever the case may be. So this is their argument, that they believe Social Security one day, it's been around for 90 years, but one day it's just going to, its internal contradictions, it's just going to fall away and everything is going to be beautiful and we'll have all that money on Wall Street. Um, they argue, not so fast. We need to do something to make sure the demise of Social Security comes to reality. And so they have several different attempts, kind of a two-pronged strategy to do that. One is to divide supporters. So they specifically say in here that we need to neutralize supporters. Neutralizing, buying out, or winning over key segments of Social Security. So y'all people that support Social Security, you need to be neutralized according to the strategy. And how do you do that? Well, you sow hate and discontent. You float stories that it's going to be bankrupt. It's a Ponzi scheme. The money is given to Ukraine. It's given to illegal immigrants. It's the trust fund is all IOUs. It's all phony money. It was stolen by politicians. I've done videos on every one of those to kind of write the record. You may disagree with me. Make sure you put it in the comments if you do, and we'll have a nice little discussion. But that's one part of the strategy, to reduce confidence, to destroy confidence that Social Security would be there in the future, and that way it makes it easier, as they argue, when there is a crisis. Says the quote out of this: finally, we must be prepared for the long campaign. The next Social Security crisis may be further away than many people believe. So they're looking for a crisis. The aim is to weaken political support for the present system when the next financial crisis appears. I forgot the end quotes there, but this is a specific quote from this article here. So the aim is to weaken political support. How do you weaken political support? Well, you weaken support from Main Street out there. You get people to believe these, internet myths of all this other thing. So they say, well, it's not going to be there in the future. So why should we really support it? Why should we call Congress and make them do this, that, or the other? Who cares? And then that's when the other shoe drops. So they weaken support, and the power hates a vacuum. When the support is gone and the crisis happens, who's going to be there? The white knights on the shining hill coming down. It's going to be Wall Street and the Koch brothers and health insurance companies and all the rest of it. Banks, insurance companies, and other institutions that will gain from providing such plans to the public, including, obviously, so that over $1 trillion is going into Social Security, every year. And unfortunately, right now, more is going out. That's why the trust fund is being depleted, because you got over $1 trillion coming in through FICA taxes and all the rest of it, interest on the trust fund, and also the taxes that people pay on Social Security. So those are the three sources of income for Social Security, FICA. But more is going out because the baby boomers are the baby boomers. 76 million people were born from 1946 to 1964, and those people are getting of age and they're retiring. So that trust fund was intended for that. The intention of the trust fund was eventually to be depleted and not needed anymore. In the future, you need a new trust fund. So there's been several trust funds throughout the Social Security history when needed it for future projections. So the trust fund being, using all the money for the trust fund, and one day the trust fund is not going to be there. Yes, that's how that thing works. So this is you can read this yourself, the two-pronged strategy, again, to weaken and then have a system in place where the banks and financial institutions can jump in there when there's a crisis. And if there's not necessarily a crisis, maybe we should just sit around and wait for a crisis. And this is if you're a frequent viewer, that political inaction, politicians kind of just kicking the can, because right now It looks like the trust fund is going to be depleted in 2035, but at that time, the incoming receipts will only count for about 83% of benefits. So you're going to get a 17% cut in about 10 years, unless Congress does something. So I would argue, and a lot of people put in comments, you agree that Congress is, delaying and delaying and delaying and delaying, and that way there's a crisis, and then all bets are off, and this plan can finally be initiated. So that's. I just want to, people will say, well, okay, do you have a kind of a smoking gun that proves that this is a long-term strategy and this is their attempt? Well, yeah, kind of, yeah, right here. So, all right, let's move on. I did that in 10 minutes, so that wasn't too bad. If you have any comments, if you completely disagree, if you've read the article, and yeah, again, I'm still timing the mischaracterizations and the misquotations. So please make sure you watch the video before you comment, please. All right, so let's go ahead and get your questions, all things Social Security. Titus's mom, hit the like button while you're waiting for live. Yes, please. More people get the information out there. When would be the best time to start collecting retirement benefits to be able to make the most income before I actually quit working? It really depends on your age. If you're obviously early retirement, then you're limited to the amount of money you can make. That's $22,320. If you're over your full retirement, it doesn't matter. You can make all the money in the world, no problem whatsoever. And in terms of the annual earnings limit, there's also a monthly earnings limit as well. So if you're early, before your full retirement age, and you're making $1 billion a year, but you stop working in July, the first month, let's say August, August, you stay under $1,860. That's $22,320 divided by 12. $1,860. The first month you go under $1,860, you can start your benefits, and what you made prior to that has no relevance whatsoever. The next year, you have to stay under the annual earnings limit. You can't use the monthly limit again. So, Susan, when you collect ex-husband's Social Security and he hasn't retired yet, would your Social Security payments go up if he makes more money? Yes. The only reason Social Security would take a claim, you're talking about what's called an independently entitled divorced spouse claim. So the only reason they would take one is if there is more money there. They're not allowed to take claims if there's no more money there for you. So yes, if you file the independently entitled divorced spouse benefits, so Susan, good job on that. That a lot of people out there are walking around and they're entitled to money on their divorced spouse, but they think they can't get that until that person retires. That's 100% incorrect. As long as your ex-spouse is 62 years old, you can start your benefits. But you have to file for benefits on your own record first. So you file for benefits on your own record, and then if your ex-spouse's benefit amount, the PIA, the primary insurance amount, the amount at the full retirement age, if it's twice years, then you can start your benefits. You can get extra benefits on top of yours. IRS says couple selling house has 500K capital gains exemption. Does that mean anything above that IRMA? Yes, if you have that exemption, then anything above that is IRMA. Correct. Yeah, for single it's 250. For a couple it's 500. So anything over that, they will add on the extra Part B IRMA premium. It's only for 1 year. If it's based on the sale of that house. If you work the next year and make $1 billion, then obviously it's for another year. But did you research Social Security has a special stack of treasury bonds, government borrows yearly to redeem bond short of Yeah, no, all the money is there, present, and are accounted for. The full faith and trust of the full faith and credit of the United States government, and Japan has over $1 trillion of the same bonds. Your 401k has the same bonds. I saw an article today that Warren Buffett sold half of his Apple stock and he put it in those bonds. So all those people seem to trust those bonds, that they're not fake IOUs. And again, it's full faith and credit of the United States. That green stuff you have in your wallet, same exact thing. So if you don't believe those are actual money, then send them to a dog shelter or someplace. Yeah. Question, please explain collecting Social Security on an ex-spouse's benefit, the basic version. Yeah, I think I just did. So I think I foresaw your question. So yeah, if you're entitled, if you have to file for benefits on your own record, so you can file for current spouse or divorced spouse. You had to be married to that person for 10 years or longer. It doesn't necessarily have to be consecutive. You could have been married to the person for 5 years, remarried that same person, but it had to be by the end of the next calendar year. Married, stay married again for at least 5 years, and they can add those 10 years together. 5% of Americans remarry the same person, so I always have to add that. And then as long as that person's benefit amount is twice your benefit amount, the PIA, the primary insurance amount, the amount at full retirement age, you can get extra benefits on top of your benefit amount. You can't currently be married. And then there's surviving spouse benefits. If you were married to someone for 10 years, if you divorced, or if you were married to them when they passed, if you were married for at least 9 months, or there's a couple exceptions there as well, you can get benefits on that person's record starting at 60 years old. Is that a short enough version? I've got a whole bunch. I've done over 600 videos. I've got dozens and dozens and dozens of videos on spouse benefit. So I think I'm going to do another spouse benefit video with a kind of an update, because there's a lot of false information going out there about spouse benefits. So I spend, I think probably 25% of my videos are videos correcting all of the internet myths out there. I'm not retirement age, but I want to retire at 58. Any suggestions, recommendations? Yeah, you can retire from work, but you ain't getting Social Security. So there's that. Unless the people, if you're disabled, you can get it at any age. If you're, disabled widows, you can get it from 50 to 60. But yeah, unfortunately, you'll have to wait till you're 62 years old. Husband died 1296. How to get earnings record? I am full retirement age at 62. Social Security said 1402 now, and Frost said 1355. Also, earnings not filed for 19. Yeah, for an ex-spouse, it's very difficult to get to correct their earnings record, even if you're able to access. If you go down there and show your marriage certificate and divorce decree, or marriage certificate and death certificate and all that kind of stuff, even if you can, oh, that doesn't look right, you would have to get those earnings. You have to get the IRS records and prove it. And yeah, it's very difficult for a surviving spouse to correct earnings record. Even if they should give you access to it, freedom of information and all that stuff, but then it's difficult. It's difficult for everybody. That's why I continuously say, I think pretty much every video I've ever made, I always say, make sure you check your earnings record every year. Once you file your taxes, a few weeks after you file your taxes, the IRS notifies Social Security how much you actually paid into FICA and stuff based on what earnings. Go in there, tell everybody especially young people, to check every year to make sure those earnings are correct. Make sure nothing is missing, because if you wait for 20, 30, 40, 50 years when you retire, you might not have the proof, and you'll be losing money for the rest of your life. Let's see. Can you request presumptive SSDI if you're waiting too long for a case manager? No, not really. You can request a request an expedited, call them up, and waiting too long for a case manager. So you probably mean, I'm sure it's already out of the Social Security office. The case has already gone to DDS, the Disability Determination Services. And what happens is, once it gets up there, those are the people that do the medical determination, get all the medical records and everything. Once it gets up there, they assign it to an examiner, and I would reach out to that person. So call the DDS in your state and find out who your examiner is, who's handling your case, and just kind of check in and say, hey, just kind of make up a kind of a BS. Oh, I just want to, did I mention that doctor? Just something, small talk. Or if you ever need anything, I'm going to go to the doctor, and I'm going to go to a new doctor next week. And so should I go ahead and notify you and stuff? So, in your opinion, What are the top 3 things that need to be done to keep Social Security benefits solvent? Enjoy the rest of your Sunday. Yeah, I appreciate it. Yeah, definitely not increase the retirement age. And 100%, I've mentioned this many times, it's increase the cap. $168,600. Anybody that makes over that, yeah. So if you're making, you know, um, if you're making under 168,000, you're paying 12.4% of your money into Social Security. You're paying half, and your employer's paying half. If you make $2.5 million, I just did the calculations the other day, so I know this. $2.4 million, I think I did. You're paying 0.87% of your money into FICA. That is completely unfair. And then I would also change the COLA calculation, so you get yeah, more 2% more every month. But yeah, if the cap is increased, the president argues that it should be the same between 168,000 and 400,000. Shouldn't increase, shouldn't, raise the cap, kind of like a donut hole. He argues that over 400,000, it should be just, they should pay just like all the rest of us. Harris supported the current president's plan for that, but before she became vice president, she supported what's called the Social Security Expansion Act, which just said it was basically the same thing, only she argued at the time it should be for anybody over $250,000. So I'm not sure. I haven't seen her new policy now that she's independent, but it's probably going to be about the same. So just received a text from a friend. Her disabled son's student loan received an approval. Yay, student loan discharge. Awesome. Awesome. Yeah, that's the GI Bill and all that, and all that, all the people that came back from World War II and got the free GI Bill, and now those same people are arguing that, no, you should pay for your education. Yeah, so, but I like living in a country with a bunch of smart people, educated people. While on I'm not going to say anymore. While on SSDI, you get Medicare Part B, and I guess you also pick a supplement if choosing one. Do you need to pick dental and vision plans in addition to Part D prescriptions? Yes, after you are on SSDI, Social Security Disability Insurance, after 2 years of being on that, you essentially are automatically signed up for Part A and Part B. And yes, then you have to pick some type of thing to cover all those gaps. And not necessarily a supplement. I see what you mean by a supplement. So there's Medicare supplements, also called Medigaps, and then Medicare Advantage plans. And in most states, people on disability, people under 65, cannot get a Medicare supplement plan, one of those N's and G's. Or if they can get them, they're crazy expensive. So most people have to get a Medicare Advantage plan. And if you get a Medicare Advantage plan, rather than have nothing and just Part A and Part B and exposed to all those financial gaps, Medicare Advantage is the way to go. I wish it was better, but anyway. But with the Medicare Advantage, most of those already have a Part D in there, prescription drug plan already bundled in there. They also have some level of dental, vision, and hearing. So you need to get one of those. And those change every year. So it's important that you check those every year. And the time coming up here is October 15th to December 7th. And next year, 2025, is going to be the big year. There are going to be a lot of changes. A lot of changes already be announced. These companies are going to be pulling out of particular areas. So it's very important that you get with your insurance, Medicare insurance agent or broker, and check to make sure you are still in the same plan, because in the best plan for you, because all those plans change. You'll receive it's called an ANOC, an annual notice of change, in September. It'll tell you all the gory details. And if you look at it and your eyes glaze over, because that's kind of the intent, I guess, is to just say, forget about it. I'll just go ahead and let it ride. And then the insurance company wins, because they have probably downgraded your policy and they've left you exposed to more things. So that's why it's important. If you like the same company, they probably have a dozen different plans in your area. Same, keep your doctor, zero premium. They just, you know, and last year your hospital was $100. Now it's $500 a day or something. So those plans change every single year. So make sure you get with someone you know and trust, and yeah, check those out. And if you need help from us, because there are so many bad actors out there, I put together a team that can help out. It's 100% free, just like all agents and brokers throughout the country. And so click on that little link there, and it'll take you to a place you'll see one-on-one Medicare help. And then you click on that, and then in the form it says, I'm good now, but put me on your list for October. So you click on that, submit it, and then in October, when the new plans come out, we'll contact you and we'll compare what you have, your new plan for 2024, 2025 that you have, with all the other plans out there, and we'll make sure you're getting everything you need to yeah, take care of yourself in the future, you and your family. All right, let's see here. Does rib limb apply for my husband deceased if his FRA was 66 and he filed at 65? Okay, yeah, thank you. I think I got a comment on this one, and I told them to come on in so I could give you a better explanation. So thank you for coming in onto the live Q&A. Yeah, the rib limb, limb, widow's cap, all kinds of different names they call it. Probably not on yours because he did not file early, so you should be good. But in these particular cases, because survivor benefits, there's all kinds of different, permutations, and but you should, if you mentioned deceased and was 60 and he filed. Okay, so, but I think I remember on the comment that I think you're 60, 62 or something like that. So you're going to be reduced because you file early. If you're full retirement age and he was essentially receiving close to his full benefit, you're going to receive 100% of what he was receiving. If he waited till after, some people wait after the full retirement age and get those delayed retirement credits. Surviving spouses also get those delayed retirement credits. But in your case, I don't, rib limb shouldn't be relevant. But some people think that their spouse retired whenever, and maybe they filed early and then started working sometimes or something like that. So just to be on the safe side, 100% safe side on this particular situation, I always recommend calling up Social Security, schedule an appointment, surviving spouse claim, and then checking. That's their job, is to give you the definitive numbers. And in this case, it's good. So call up and say, okay, hey, if I started surviving spouse benefits this month, how much would it be? And they say, let's say, 1230. What if I started it this time next year? How much would it be? And if they say 1230, that means, it sounds like a rib limb is going to be taking effect and you're capped out or something. It usually happens at 62 and a half. But if they say, okay, next year you're going to be 1500, you're like, oh, okay. Well, do I need the 1250? Do I need the 1200 now, or can I wait for the 1500? Am I working? Longevity? Am I healthy? Yada yada yada, and then make the decision there. So, and at that time, you're filing for a surviving spouse claim. But if they give you the numbers for a year or 2 years from now, and you say, I'll wait, then just say, I'll wait. And it's, the Social Security employees are not like car salesmen. Sorry, car salesmen, but they're not going to, oh, I just lost the sale. No. That means they can go back to their desk and work the other 400 cases they have pending. So don't worry about that. Thank you for your daily lives. What's the initial steps in filing SSDI online? Any advice? I am in preparation to file SSDI. Yes. Watch my 3-4, a whole bunch of videos, but I did 3 videos a couple of months ago on filing for disability, and it goes through the entire procedure. I give you a bunch of tips, tricks, and secrets on medical records, and on the appeals process, and whether you need a lawyer or anything like that. So just go to my YouTube homepage there, and most of the videos I do recently are under the live tab. But yeah, just search for 3 videos on filing for disability, and watch those, and file as soon as possible, because Social Security takes anywhere from 3 to 6 months to make a decision. So the sooner you get the ball rolling, the better. File and prepare for denial, then hire a lawyer. Sid. Yeah, the first 2 steps, you don't really need a lawyer. If you want a lawyer, go for it, but it's, you're gonna pay him over $7,000 for something you can pretty much do, so. I get 10% VA disability, so if I get SS disability for a different reason, will they reduce my SSDI? Nope, not at all. Doesn't affect one or the other. You are completely good. Completely different systems, completely different parameters, criteria for disability, but yeah, one won't reduce, your VA won't reduce Social Security. They signed me up for widow and disability at the same time. My husband passed 2020. I'm still waiting for another approval or denial. I asked for widow's benefits, but they said I would mess up everything. Um, yeah, if they signed you up for widow's benefits and disability, that sounds like you might be between the age of 50 and 60, and you filed for disabled widow's benefits. So if they signed you up for widow's benefits, I'm not sure why you asked them to sign you up for widow's benefits again. I asked for widow's benefits, but they said I would mess up everything, but they already signed you up for widow's benefits. So yeah, so you can receive widow's benefits based on disability or widow's benefits based on retirement. The widow's benefits based on disability is usually more. So no use in doing, yeah. Came in the middle of the previous live stream and you were talking about years of military service being eligible for an increase in income for those years. Yes, pretty much if you served in the military in the last 20 or 30 years, um, just when you file for your retirement benefits, I'm sure they asked you if you served in the military and they put it in the system. But if not, if you don't remember, call the 800 number and just say, hey, did you include my military service? It's not a whole heck of a lot, but hey, a buck's a buck, a buck. They just give you a little bit extra earnings for when you worked in the military in the 70s or 80s or whatever. Do you know of any Medicare plan that helps with dentures? Yeah, there's a lot of them out there. There's even some Medicare Advantage plans that are covering implants, and implants are crazy expensive. So they implants, plural. It's probably just singular because I think they're yeah, crazy amount of money. And all of those, again, the Medicare Advantage plans for 2025, uh, everybody pretty much knows that most of the plans, if not all the plans next year, I'm not going to say all of them, but a vast majority of the Medicare Advantage plans next year are going to be not as beneficial as they have been. I think the kind of the all of the craziness that has been going over the last few years is these Medicare Advantage companies just competing with each other and giving out more stuff and more stuff and more stuff. I think that's pretty much coming to an end, and now they're going to start pulling back. So now is even more of a reason for you to check that every single year. So, and right now, Cynthia, doesn't matter because unless you're receiving Medicare Advantage dual eligible, or you've recently moved, or you're receiving the extra help from prescription drugs, you can't change your plan until October anyway. And we don't know what the plans for 2025 are going to be. So Cynthia, yeah, reach out to your agent or broker, reach out to us, and if you need dentures, then. But that's a good strategy, though. Reach out to us, and we can find a plan in your area. But that's a good strategy. So again, as I always say, these companies aren't giving you this stuff because they're, super cool and nice and all that kind of stuff. It's a business. They're, don't get to be, billion-dollar companies giving out stuff for free. And this money, all this money is your money. All those decades you paid into FICA taxes included Medicare in there. So you're just getting this money back. So it's important that you do the right thing and get as much money back as you possibly can. And how do you do that? Just like Cynthia there. Okay, next year, I'm pretty healthy. I don't think I really need anything. So I'm going to pick a particular plan that has more dental and that has dentures and stuff like that. And this plan is not great in terms of hospitals, and it doesn't have my primary, but maybe I'll go to another primary next year. But this particular plan has a lot of dental, so I will use the dental part next year, and I'll get all my dental work done next year. And then next October, I'll switch back to the plan I like with my doctor, or whatever the case may be. So that's the trick. That's the trick. So if you're going to be going to the hospital, you're going to have an operation next year or something like that, then pick a plan that lower, zero hospital, and has your your specialist that's going to be doing your surgery and all that kind of stuff. So that's what you do to be smart and get money, all the money back. Thank you, Ed. Yes, please do another spouse benefit video to get it back out there. Thank you. Yes, yes, I certainly will. I would like to know what the exceptions are for the 9-month marriage requirement. So that is for this. So the 9-month is for surviving spouse, and there's a couple exceptions. One of them, typical exception, everything. The person was in the military and they died in the line of battle, um, or um, it was an accident. If someone um, if you marry someone and when you married them, they had cancer and then they died 8 months later, that's unfortunately no. But if you marry someone and then 8 months later they pass away in a car accident, then that's an exception. So to draw an ex-wife husband for a Social Security must have been married 10 years. Yes. Or remarried for a total of 10 years. No exceptions. I just had my interview Friday. My marriage lasted. Yeah, no exceptions on that. Yeah, unfortunately. There are exceptions to exceptions on almost everything, but on that particular one, yeah, there's no exceptions, unfortunately. But there are exceptions on the surviving spouse 9-month one. Cadillac Jag. Hey, Cadillac Jag, long time. Agree, yes. Increase the cap. I'm curious how people are missing out on possibly drawing on ex-spouse over 10 years record when the Social Security retirement application requires you to list details of your prior marriages. I agree. Yes. One of the things is people, they file for benefits and their ex isn't of age yet, so they just don't do anything and they're not entitled to any more benefits. And I've also had, yeah, you wouldn't believe it, people that are married and one files and they file a line, or there's a bad Social Security employee that doesn't address that issue, or they just, hey, tell your wife to come in here and file, there's extra benefits, and then the husband or whoever forgets. And so, yeah, you'd be surprised, shocked, dismayed at how many people are not getting his benefits. If I get workers' comp settlement, how will that affect my Social Security disability? It depends on what type of workers' comp it is. If it's like a public disability type stuff, some of those, if it's a true workers' comp type thing, it really depends on what it is. So you have to tell Social Security. And basically what it is Congress decided that if you start receiving Social Security disability insurance and it's like, say, $2,000, and then you also receive a workers' comp that's $4,000. So, or excuse me, $2,000. So it's $4,000 total. But your entire life, your average work that you did in your life, you only made an average about $3,000 a month. So Social Security or the Congress decided a person can't get more on disability than they were actually making while they were working. So that's why that is reduced. If you're receiving that type of workers' comp, your Social Security disability is reduced. And that also counts for a lump sum. So a lot of people think they can, do an end run around the system and say, well, I'm not going to get monthly benefits. I'm just going to tell them to send me a check for, $500,000 to, settle it. So that way it won't affect my Social Security. Yeah, nice try. Social Security, yeah, takes that into consideration. So there's that. Divorced 2018, info by 3 lawyers, no spousal support. Special program for divorced spouses, 50-year disabled, minimum 10 years, ex-husband, retired, collecting Social Security, entitlement to 50%. Okay. All right. So I'm not sure if there's a question in there, but yeah, lawyers don't know Social Security. They know disability, but usually not the other stuff. Yeah, there is a special program, well, not super special, but disabled widows benefits. If you're between the age of 50 and 60, you could be eligible for disabled widows benefits. Yeah. Let's see. What is your opinion about dental plans being offered? I've heard from a lot of dentists that standalone policies are not very good. Yeah, some of them are good. Yeah, some are good. I've got a company that I use. You click on the link there and check out those plans. But yeah, you just have to find a dentist, and what you need and everything. But the standalone dental plans, the alternative is the ones in Medicare Advantage, and unfortunately, the ones in Medicare Advantage are usually far, far worse. And standalones are usually better than those. So glad local field officers all back open. Yes, yes, I agree. I think Cleveland, I think it was Cleveland, the district office in Cleveland had to close down because they didn't have enough staff to open the doors. So Social Security is at a 27-year low in terms of staffing. And if the Appropriations Committee budget gets instituted, they're looking about cutting about a half, $500 billion out of the Social Security budget, or $500 million out of the Social Security budget, which will bring staffing down to the worst in 50 years. So it's basically, that's another end run. That's another part of the long-term strategy that I talked about today. The strategy is, to ruin people's confidence in Social Security. Another way to do it is just destroy customer service. Cut your budgets. Don't let Social Security hire the staff. Don't let them spend time training staff, and don't pick up the phones and stuff like that. And people just completely frustrated and said, you know what, forget about it. Just give it to Wall Street. And they're like, aha, we won. So please support Social Security. If you don't like Social Security, then whatever. But I do. And it's one of the most successful poverty alleviating programs in US history. Do a little research on poorhouses. Yeah, there were things in the old days called poorhouses. If you didn't have Social Security today, there'd be a lot of people in poorhouses. They actually had them. They'd lock you up. So we don't want to bring those back. I didn't remember that the date, so I actually answered that question incorrectly because I stayed physically. Okay. All right. Looks like having a little conversation amongst the community here, which is I appreciate. Awesome. I received VA disability, so if I get Social Security disability, will it be reduced? No. Before filing, one needs marriage certificate and divorce decree for all marriage and marriage certificate. Yes and no. You need it before you can start your benefits, but please do not wait. I get people that lose money every single day because I'm going to go ahead and file for spouse benefits, but I requested my marriage and divorce decree. I know I need that, so I went ahead and requested. So once I get that, I'll call Social Security. You just lost a whole bunch of money. Every month you wait, that's a month of checks you're losing. So call Social Security, schedule an appointment, and tell them I want to file for spouse benefits, divorce spouse benefits, surviving spouse benefits, and then start getting your documents. So you don't lose that month or the 2 months, because it's going to take 2 months to schedule an appointment. And if you don't have your documents at that time, don't sweat it. Go ahead and go to the interview because you might not actually need it. So it depends, a lot of variables there. So schedule the appointment first. Hi, I called the Social Security to file the spouse divorce claim. It was received well, but I did it. But the lady didn't tell me when to expect the change. Do I need to do anything else? No, you should receive a letter. If this is a new employee, then she'll have to go under 100% review. So the technical expert might be reviewing it. Or if she's any other employee in Social Security, she probably has hundreds of other claims that she needs to adjudicate as well. And then once she gets to it, then she'll get that adjudicated. You'll receive a letter in the mail that'll tell you, hey, your benefits are going to increase by yada, yada, yada. Sometimes you get the check before you get the direct deposit, before you get the letter in the mail explaining it. So you look in your bank account and says, wow, the Social Security just went up. Oh, that's a nice COLA. No, your claim was approved. That's not really approval. For disability, you're approved for disability. But for, well, I guess, none of it should be called approval. If you're entitled, and people hate the word entitled, there's entitlement. People think, no, you're entitled to these benefits. You paid into FICA taxes all those decades. If you're really disabled, that's your money. If Medicare, that's your money. For Social Security, spouse benefits, disabled widows benefits, retire, that's your money. That you're entitled to it. There was a court case in the early 1960s that some people on social media like to use that say, no, you're not entitled to it. It's Social Security can take it from you all. Yeah, if you get thrown in jail, in prison, it's like people in prison have sued and say, hey, that's my money, I want it. Say, well, yeah, you're in prison now. Or the case that happened in the 1960s was this guy, I forget what country in Europe, but he worked in the United States for many years, paid into Social Security, then move back to his country and he says, hey, that's my money. That's like a private 401k IRA thing. I want my money back. And they say, yeah, no, you can get it. Come back to the United States and you've got your citizenship or green card. Yeah, that's your money if you fulfill these particular requirements. But yeah, you are not a US citizen. You don't have your green card anymore. So you're not entitled to them anymore. So yeah, nobody's been denied for retirement benefits if they're not in prison and stuff like that. So yeah. If you're an SSD, I'm going to have to make a video on that, entitlement versus entitlement. So clear the record out there. If you are an SSDI after 50, how many times do you get CDR? Thank you very much. Yeah. It really depends on when your disability claim was approved. They gave you a certain cycle for your continuing disability reviews. You don't need to worry about it this year because they've suspended CDRs until the end of the fiscal year because of low staffing. But yeah, it's, every 3 years, 5 years, 7 years or something like that. And watch my videos on CDRs. People freak out about CDRs and you really shouldn't. If you're truly disabled, just fill out the paperwork to the best of your knowledge, return it, and that's it. Yeah. There are exceptions for VA marriages. Not sure. VA marriages, not sure. Virginia marriages? Veterans Administration? Let's see. Something about the marriage was in 1999 and I didn't have my divorce decree. Yeah, so you just contact the county. If you don't have your original divorce decree, no problem. Just go contact the county there, wherever you got divorced, and they'll send you a copy of it. It has the raised seal, the red stamp, and all that good stuff. And that's considered the original document by Social Security. I've got friends, relatives tracking down official divorce decrees and marriage certificate random. Yes, yep. So you can get it. I've never had anybody that wasn't able to get their marriage certificate and divorce decree in the United States. I've had people getting birth certificates. They were, they were born way out in the country and they never did anything like that. So that was tough. So we had to use a preponderance of the evidence, had to use school records and life insurance policies and all that kind of stuff to prove their age. At what age does Social Security disability change to Social Security, and does the amount change? Yeah, if you're on disability insurance, Social Security disability, when you hit your full retirement age, your benefits automatically switch to regular retirement benefits, and the amount doesn't change. The pay date doesn't change. People don't even recognize the switch. I have been rejected 3 times for an implant and 3 to 4 crowns. Both are necessary. What do I do now? Yeah, on dental, like that, I would switch your plans. It sounds like you probably have a Medicare Advantage plan, then I would switch plans. Unfortunately, you can appeal it through your current company because you can't switch your plans probably until October and it won't take effect until January 1st. So you can appeal it through your current company. One of the problems with dental is if you have like a medical operation and the insurance company denies you or something like that, if that's something that would normally be covered by Medicare, if you had like a Medicare supplement and it was approved immediately, and because you don't need prior authorizations with that, but a Medicare Advantage can deny you privatized Medicare. But you can appeal it and you say, hey, Medicare covers this. Why are you not covering it? And so you have kind of a case. But in terms of dental type stuff, Medicare doesn't cover dental, which I completely disagree with. I think original Medicare should cover dental, vision, and hearing. But yeah. So I would appeal it and try your best to get that done this year. But once October comes around, contact us or your agent or broker and find a new plan, a new company. And hopefully they will. But even then, unfortunately, it's not a guarantee because these Medicare Advantage plans are, they're private companies. They can kind of do what they want. And now with the Supreme Court ruling, they can even do more what they want because they don't have to listen to the government. All they have to do is hire the best lawyers and make their own regulations. I'm on SSI. I will be 62 in October. What will happen? How should I choose? Well, unfortunately, if you're on SSI, you don't have a choice. If you're on SSI and you're entitled to retirement benefits at 62, you have to take those retirement benefits. Anytime there's any other benefits out there when you're on SSI, which is the welfare-based program, you have to take those benefits. If you're 60 and you're entitled to surviving spouse benefits, you have to take those benefits. Um, which I understand it it's not a good system because you're saying, okay, I'm on SSI. If I file for retirement at 62, it's only going to be about $900. So I'll get $900 from my retirement and I'll get the other $43 from SSI for a total of $943. But if I would have waited until my full retirement age, it would have been $1,300 and then I wouldn't need SSI in the future. So it's stupid for the government to tell me to. Yes, I understand, but it's a welfare-based program. So yeah, that's something we should definitely need to look at. At what age are you required to start Social Security? You're not required to start at any time. You're required to start paying as soon as you start working. If you're 5 years old or 10 years old, you're required to start paying FICA. But in terms of, yeah, you can start at 60 for surviving retirement. 62, you can wait until your full retirement age. The latest, I would require you at the very latest to retire to get your benefits at 70, because after 70 your benefits don't go up based on delayed retirements. So that's the only requirement, but Social Security doesn't require you to do that. I require you to do that because I don't want you losing money, but anything before that is completely your decision. 65, worked for covered insurance. Should I sign up for Part A anyway? All right. Okay. You work full time. Okay. Yeah, if you're 65 years old and you're about to come up on your Medicare time, which is 65, obviously, and you're working, you have health insurance from current work, and your employer group health plan has 20 or more employees, your work or your spouse's work, then yeah, you can sign up for Part A if you want. Yep. And, refuse Part B. Um, but if you're contributing to a health savings account, then you have to stop that health savings account contributions 6 months before. You can still have money in there and withdraw and all that kind of stuff in the future. But in terms of contributing, you have to stop contributing 6 months before. All right, we're getting close to the end, and this is the time I like to jump around a little bit. So I'm going to probably skip over some questions here, and I want to find people that I've never seen before. Can Social Security help with housing assistance? No. They can, you get SSI and all the rest of it. But watch my video. Go into my YouTube there, and you'll see videos that say living on Social Security. I just did an updated one a couple, 3 weeks ago. And there's a bunch of programs, over 40 programs that I go through that might help you out, make your life a bit easier. So make sure you check those out. Freddie, I have 57, neck and really bad arthritis. SSDI was approved. SDI was approved for SSDI. Claim was pulled for quality review. Now case has been returned to DDS. Why do you think they sent? Yeah, no telling. Sometimes it's something important. Sometimes it's something just, hey, you forgot to dot this I and cross this T. It's unfortunate. But in these cases, I would be very, very vigilant and keep up on them, because I've seen this too many times. They need to do a better job of tracking this when it's from quality review, because what happened is your case was sent from the DDS, sent back to Social Security, but in between, quality review pulled it to check the quality of it, to make sure everything's done is good. And if they see something that's wrong, they send it back to DDS to correct it. It might be just something very minimum, or it might be, you denied it. It should be approved. It was approved. You should be nice. So you don't stress out. That means nothing. It's just a random quality review. But to be cautious on this is sometimes they get lost in the mix. Sometimes the quality review sends it back to DDS and it doesn't get assigned to an examiner. Sometimes it goes back to the same examiner. Sometimes they say, no, I want another person to look at it. And then once that person looks at it, it goes back, and somewhere it gets lost in the mix. So I would definitely keep up on it. Once every week or two, I would call up and say, "Hey, this is still you're still working on this. You haven't lost this, in the great void." So yeah, please be vigilant on that and make sure it gets taken care of. All right, let's see. Got any new people? New people. Kim Jones. I don't think I Dr. Weir, so to confirm, since I'm not doing Social Security until 66 and month, and will have to sign up for Medicare, or will they send? And I have to sign up for Part B and D, right? All the same. Yes. If you are how it works, if you're currently receiving Social Security benefits, retirement, survivors, spouse, whatever the case may be, and then you turn 65, you're already receiving benefits. About 100 days before you turn 65, Medicare sends you everything automatically. And at that time, if you don't want Part B, you can, refuse it. If you're not receiving benefits, then you actually have to contact Social Security and file for Medicare and say, yes, start my Medicare. Don't start my money. Don't start my monthly benefits. Just start my Medicare. Or just start my Part A. Or just start my A and B, no money. Or start my A, B, and money. Whatever your case may be. If you are 65, and again, if you're working and have health insurance through current work, yours or your spouse's, your employer has 20 or more employees, then you don't have to do anything if you don't want to, unless you want to sign up for Part A. So, all right. Let's see here. Jackie, I don't think I recognize Jack. Survivor benefits. If you didn't file right at turning 60, will you get back pay for the months missed? No, unless you called them. So let's say you're 60 and 6 months, and you call them at 60 and 6 months, and to schedule an appointment and stuff, but you would call them however many months earlier than that, and they gave you incorrect information. In that case, you can go back and get those missing benefits, if you fight for it. But the only time they give you kind of an automatic retroactivity is after your full retirement age. Got friends, relatives not born in the U.S. but are now U.S. citizens. They needed to provide U.S. passport or certificate of naturalization. Yes, yeah. In order to get, again, another internet myth out there that people can get retirement benefits and survivor benefits and spouse benefits and disability, even if they're undocumented. No, I've done hundreds of thousands of these, and I have to see your citizenship or your legal status in the United States. If you don't show it to us and we can't confirm it through the INS, then sorry, you don't get benefits. Even if you paid, I paid 40 years into Social Security, and that's my money. Yeah, it is your money. You have to prove your citizenship or your legal status in the United States, and it's all yours. If you don't prove that, then thank you for the donation. And the donations are up to what, $27 billion a year. So there's that. So many internet myths out there. Again, that's the strategy. That is the strategy to hate and discontent into the system. Start all these internet myths and perpetuate the lies and the BS. And so y'all just say, forget about it. It's not going to be there anymore. Just give it to Wall Street. Signed up for ex-spouse benefits and denied because birth certificate took too long. What should I do? Yeah, not really denied. You're just not approved at that time. So yeah, if you now got the birth certificate, just go ahead and provide the birth certificate, and they'll reopen the claim and give you that money back. Yep, easy, easy, easy. If it was something 5 years ago that you did, then it might be more difficult. But yeah, I would make sure I would fight for all the benefits. If it was 2 months, 3 months, 4 months ago, then they should give you all that money back. Beth, if I'm on long-term disability and just turned 60, when Social Security will offer me the retirement at 62 or 65, or when? So not sure what you mean by long-term disability. Do you mean Social Security disability, or do you mean long-term disability from a job or something like that? If you mean a long-term disability from some job or something like that, no relevance to Social Security at all. You can get your benefits at 62 or 65 or whenever the case may be. So long-term disability from a private company, no relevance whatsoever. Let's see here. Okay, we're out of time here. Let's see. if we got any questions from new people. Receiving early retirement 64. Should I apply for SSDI? Yeah, if you're still under your full retirement age, and you are disabled and unable to work, then it doesn't hurt. Yeah, definitely. Absolutely. Watch my videos on how to apply, it gives you a whole bunch of tips, tricks, and secrets. Do you continue to get charged a late enrollment fee when you change from disability to retirement? A late enrollment fee. Um, are you talking about Medicare, the late enrollment penalty? Yeah, once you get that, it's forever. Then do you need to start Medicare Part A at age 70? Um, that's 70. So trying to figure out what these questions mean here. Yeah, if you are working up until 70 and you have health insurance from work and everything I mentioned and you're happy with it, then yeah, you sign up for Part A, Part B, or Part A, or whatever you want to at 70 or 75 or 80, and there's no penalty whatsoever as long as you had health insurance from current work, yours or your spouse's, since you were 65 and your employer had 20 or more employees. All right. So I think we're over time there. If I didn't get your question, I apologize. Make sure I will be back again tomorrow. Make sure you join me. And first thing, pop in your question. People on TikTok and other places, it's best to go into YouTube. Um, I'm able to see the questions easier in YouTube itself. So just Google Dr. Ed or my Gov Expert and my YouTube channel.